Hello, everyone. Welcome to our presentation. We are Group 4. We've made disaster exercise plan focusing on one natural disaster that could cause tremendous destructions to our society. So later, we'll walk you through this plan and demonstrate different perspectives regarding the issues and preparations to this disaster. First, let's focus on the disaster and the risks it could cause. Since Taiwan is regularly hit by typhoons every year, it's good to know how to deal with a severe typhoon. So when it happens, we won't panic. Next, we've listed three main characteristics of the disaster. First, rapidly moving floodwaters sweep people away. Second, disrupt transportation, power, and communication services. Third, contaminated fresh water. The typhoon usually brings a big rain, so less likely a big flood during the strike. After flooding, many facilities could be destroyed, including transportation, power, and water supplies. The characteristics of the disaster are showed on the left-hand side, and their potential damages or injuries are on the right-hand side. Flood waters usually cause direct physical damages, such as puncture wounds, physical trauma, and the loss of life. Others can be drowning and displacement of people. Any of mentioned damages could lead to mental health stress. The second is damage to transport systems and infrastructure, sometimes water, food, and fuel supplies. Once the transport systems or food supplies are damaged, it could lead to a more dangerous situation, like disruption of healthcare access or emergency response delays. The last one is out of clean water to drink, or even worse, people get infected by waterborne diseases. Here we're presenting four categories of risks that are highly likely to affect people during and after the disaster. By figuring out the things that will come to us, we can better understand what to prepare and how to manage the crisis. We can expect to see people suffering from PTSD, anxiety, and depression. We should keep an eye on symptoms like diarrhea, fever, vomiting, and nausea. And then we must be prepared to respond quickly to injuries, such as wounds, lacerations, bleeding, and drowning. Lastly, we should not forget people with chronic disease and make sure their continuity of treatment. By clarifying these specific conditions, we can determine which facilities and healthcare resources will need for the disaster. After knowing the disaster and potential risks, let's move on to the action plan that we've outlined for minimizing the impacts of the disaster. The action plan will be held at a community center with around 50 to 100 residents just a few days before a typhoon in order to enhance their preparedness. And there are four targets for the exercise. We'll talk through them on the following pages. Letting all participants know their risks is our first target. They must understand everyone's safety is the top priority. They must know their evacuation routes, which are made to be accessible for everyone, including the elderly and people with disabilities. They must prepare their own food and drinking water supplies because the impacts may last for a few days. By doing so, they can avoid consuming contaminated food or water and can stay healthy and positive. Second, all healthcare staff must understand their roles so they can leverage their resistance. They should be ready to provide care for injuries. Always keep an eye on signs of infection and know which patients are in need of medications. Next, we must make sure residents with chronic illness are treated so that the care for them won't be interrupted. Beyond medication supplies, some of them may rely on medical equipment to stay healthy, such as dialysis machines. Backup power to maintain the operation of these equipments needs to be secured beforehand. Lastly, we recognize during and after the disaster, mental and psychological support is vital. We want to highlight providing emotional support and a safe, calm environment are key factors that encourage the community going through the crisis.
Hello, everyone. Next, I will be discussing the critical framework of disaster response agency and the political strategy we employ to mitigate issues during crisis. Our goal is to understand how coordination saves lives. First, let's look at the government sector. There are three of them. First one, the Ministry of Health and Welfare, and the second one, the National Fire Agency. The last one, Local Disaster Response Center. And you can see how they cooperate with each other at the bottom line. To ensure these agencies do not work in silos, we use the incident command system. This allows for a unified command where resources like ambulance and the communication are shared seamlessly. Moving beyond the government, NGOs like the Red Cross and the World Vision play a specialized role, while the Red Cross focus on the first aid and the restoring family needs, and the World Vision prioritize the protection of the child and the vulnerable group. Finally, we have community and the civic organization. These are the first responder on the ground. They fill resource gap by providing meals, temporary house, and neighborhood checks. They act as vital bridge between the official government response and the actual need of the people. Despite our best plan, disaster presents massive change. We often see the next three of them we will be introduced. First one, insufficient medical resource. It would cause the medical overload. Emergency department become overwhelmed and will face the shortage of the basic supplies like saline and the antibiotics. The second one, complex triage. Flu injuries are not just one, they involve the drowning, and we must use rapid color code system like red, yellow, green, and black to prioritize the care. And that three of them, we can see it as the service breakdown briefly. Contaminated water lead to disease and the power outage, threaten patients who depend on the electricity of the medical device. So how do we respond? Our strategy is four. First, medical outreach. We establish field clinic to treat minor injuries. This keeps hospital bed open for the immediate case. We also implement strict clinical monitoring for sepsis and dehydration. Second, public health. To prevent outbreak, we enforce water safety, reminding people to boil before drinking, and manage sanitation through portable toilet to stop vector breeding. Third, chronic care. We must maintain contact base for electricity-dependent patients. If the power fails, we need to manual ventilation plans over immediate transfer protocol ready. Fourth, psychological support. We utilize psychological first aid (TFA) by creating clean environment and prioritizing children. We address the invisible wound of a disaster.
Hi everyone, and now I am talking about disaster nursing, specifically hurricanes. Now, I promise to get through this report quickly. I don't want to be just another bag of wind. Hopefully, the context will actually blow you away. Next is respond fast. This is where things get fluid. We focus on SDG 3, health, and SDG 6, clean water. Obviously, we treat the trauma, but the silent killer is dirty water, so SDG 6 is crucial. We need to stop descent like cholera, because dealing with a hurricane is hard enough. We don't need a shitty situation. I mean, a generation crisis on top of it. Finally, recovery. Here, we look at mental health because once the storm passes, the real work begins. We have to help people pick all the pieces, both of their house and their mind. We also tackle SDG 1, no poverty, because disasters have the nasty habit of breaking bank account and just leaves. Now, how do we manage all these risks without losing our mind? Enter the Sentai framework. Think of our survival guide. It has four priorities. Priority 1. Understand the risk. It's not enough to watch the weather channel. We need to know who is vulnerable. If we don't know where our bedroom patients are, we are just guessing. And in nursing, guessing is generally frowned upon. Priority 2. Governance. This is fancy talk for leadership. We need nursing in the Emergency Operations Center. Why? Because, let's be honest, doctors curing disease, but nursing run the hospital. We need to be the table to organize in the chaos. Priority 3. Invest in resilience. Priority 3 is simple. Money. We need invest in stronger hospital now, so we don't pay double later. This is like buying a good umbrella. You hadn't spend the money until you actually need it. Priority 4. Build back better. Finally, build back better. It sounds like political slogan. I know, but for us, I mean, don't just put a band-aid on bully hole. If the hospital full is time, maybe let's move the generator to the second floor next time. So, to wrap up, disaster nursing isn't just about adrenaline and sarin. It's about using the SDGs and the Sentai framework to stay afloat. Thank you, everyone.
The roles and function of nurse. Disaster set nursing mass casualty management. The most important job for a nurse at the scene to keep themselves safe, support the patient, and provide fast medical care to stop injuries from getting worse. Triage the STAR method. Triage is a way to decide who needs help first. This helps us save as many lives as possible with limited resources. We use the RPM rule. Step 1. The walkers. Green tag. Howl as loudly if you can walk. Please move to that area. Result: These people are green. They have minor injuries. Step 2. Check breathing. Respiration. How check people who cannot walk if they cannot breathe. Open their airway. Result: If they still don't breathe, they are black. If they breathe very fast, more than 30 times a minute, they are red. Step 3. Check blood flow. How press on their fingernail and see how fast the color comes back. Result: If it takes more than 2 seconds, they are red. Step 4. Check brain function. How give a simple order like squeeze my hand. Result: If they cannot follow you, they are red. If they can follow you, they are yellow. First aid and transport. Self-protection. You must protect yourself to save others. Always wear PPE to avoid infection or injury. If the area is too dangerous, ask for a professional rescue team. The order of help: always treat and move red patient first, then yellow, and final green. Smart transport: move many patients at once using large vehicles to be more efficient. Community-based nursing. Nurses do more than just treat injured. They also look after the self of the whole community. Community assessment. Nurses check how many people are hurt and how the disaster changed the community. They list available resources like food, clean water, and safe place to sleep. Health education and prevention. Use simple words to tell people about possible disease after a disaster. Content: teach people how to check for symptoms, how to keep water and food clean, and how to wash their hands properly. Cleaning: help the location government clean and disinfect the area to stop the spread of germs. Psychological support. Psychological first at PFA. Desert hurt people's mind as well as their bodies. Nurse help fix these invisible wounds. Check who is in shock or need urgent help. Sit with them and listen to their worries. Do not force them to talk if they are not ready. Link. Help them get basic needs, food and water. Give them honest information and help them find their family. Coordination and communication. Nurse at the bridge between the disaster at the hospital and the government. With the medical team. One leader, there must be one commander to make decisions and lead the team. Clear report. When sending a patient to the hospital, use a clear format so the hospital know actually what happened. Hospital choose. Know which hospital are big or small so you send the most serious patient to the best equipment place. With the government and NGO, resource sharing. Work with the police, fire department and the government to get more help for the area. Work with group. Accept help from groups like the Red Cross. When everyone works together under one plan, the recovery will be much faster and better.